Hello, my name is Melissa Harchak, and today I would like to talk to you about cast care. I would like to begin with a clinical scenario. Sally Smith is a 27-year-old patient under your care. Last week she had a closed reduction of the tibia and fibula for an injury that she sustained after falling from her horse. She has now returned to your unit 6 days later, complaining of a foul odor from underneath her cast. Mrs. Smith explains that she had been using a wire coat hanger to scratch her itchy skin underneath the cast. Upon inspection, you notice a large dent on the underside of the plaster cast. Mrs. Smith explained that this had been there since she used an end table to elevate her casted leg about an hour after it was applied. After you complete your initial assessment, you explain to Mrs. Smith the errors that she had made in caring for her cast. She responds by saying, "I did not know all of that. I was only told to call my physician if I experienced an increase in pain under my cast." Mrs. Smith had a knowledge deficit in the care of her cast, and as a result, she is now experiencing easily preventable complications. For the next couple of minutes, I would like to talk to you about the care of a cast. I will begin by describing the different materials used to construct a cast, as well as the aftercare of the freshly applied cast until it dries. Next, I would like to describe the patient teaching for a cast, including when you should call your physician. And finally, I will describe the procedure for removing the cast and the aftercare. Before I begin discussing the materials that construct a cast, it is important to understand the purpose of a cast. A cast is a device molded around a body part and is used to immobilize a fractured bone or other injury. Casts are typically made up of either plaster or fiberglass. It is important to teach the patient about the type of cast that they have, as the care for each is slightly different. With a plaster cast, heat is generated as it dries. This is important for the patient to understand so that they do not become alarmed by this reaction. It is also important to teach the patient that the cast must remain open to air as it dries to allow the heat to dispel. Plaster casts typically dry in about 15 minutes. However, they do not reach their full strength until they are completely dry, usually between 24 to 72 hours. During this time, it is important to tell the patient not to rest the cast on hard surfaces or sharp edges, as this can cause the cast to dent. A dented cast can put pressure on the underlying tissues, leading to the breakdown of skin. Also, it is important to note that once a plaster cast has been applied, it should not get wet. A non-plaster or fiberglass cast dries and strengthens within minutes after application. These casts can get wet, however, they should be thoroughly dried out afterwards with a hair blow dryer on a low cool setting. This is to prevent the skin underneath the cast from breaking down. I will now discuss the patient teaching for a cast. Instruct the patient to go about their usual daily activities, but to avoid overusing the affected extremity. If the patient is ordered an exercise regimen, encourage them to perform the routine as scheduled. Explain that these exercises help to promote circulation to the area, as well as to prevent disuse syndrome. Disuse syndrome is a weakening of the muscles due to a lack of muscle activity. Explain to the patient that the extremity should be elevated to the level of the heart frequently, and ice packs should be applied intermittently if ordered. This will help to prevent swelling. Teach the patient not to place objects down the cast to scratch itching skin. This can cause skin to tear, leading to ulcers. The patient should be taught to use a hair blow dryer on a cool setting if itching is a problem. Teach the patient to put tape over the rough edges of the cast if that is a problem for them as well. The patient should also be told to keep the cast dry, but to not place objects such as plastic or rubber over the cast for a prolonged period, as this can cause moisture to accumulate under the cast, leading to the breakdown of skin. The following things should be reported to the physician: any increasing pain or swelling not relieved by elevation or medication. Any changes in sensation, temperature, or color should also be reported, as well as an inability to move the exposed fingers and toes on the casted limb. Foul odors or stains on and around the cast, warm spots, and pressure points should also be reported. If the patient's cast would break, teach them to not attempt to fix it themselves and to call the physician. Once the patient's injury has healed, it is important to teach them about the cast removal procedure. Tell the patient that the cast will be removed with a cast cutter, but that this device will not cut their skin as it does not cut deep enough. The patient should also be told that once removed, the affected limb will be weak, stiff, and appear as though the tissue underneath has wasted away. This is called atrophy. The patient should also be told that the skin will likely be dry and flaky due to the buildup of dead skin cells. The patient should be told that their skin will be very susceptible to damage initially, and that the skin will be cleansed and a moisturizing cream will be applied. The patient should be instructed to slowly resume activities as ordered by the physician. They may also be placed on an exercise regimen to improve joint mobility in the affected extremity. Due to the disuse from being casted, the patient's affected limb will not be able to tolerate normal stresses initially. Also, you should teach the patient to elevate the extremity if swelling continues after the cast is removed, until the muscles regain their former strength. In closing, I hope that you have learned something about the care of a cast. For the nurses watching this, I hope that you will learn how to teach your patients about the care of a cast so that incidents, like the one with Mrs. Sally Smith, does not occur to your patient. Teaching may seem like such a simple concept, but it can save the patient and the hospital staff time, money, and damage wasted on complications that could have been avoided. If you have any questions, please contact me at mharchak@lhup.edu. Thank you.